My name's Emma Baker and I'm the course director for St George's for this degree. And this is the UK's first BSc in clinical pharmacology. I'm going to give you a brief overview, including explaining what clinical pharmacology is. I'm going to tell you what you will study and how you'll study it if you come and do this degree, and also explain the myriad of fantastic opportunities that this degree could open up to you for your future. Next slide, please. So clinical pharmacology is the study of all aspects of drugs as they relate to humans. I'd like you to think back to the last time you took a medicine, a pill or a tablet, such as a headache pill or an allergy pill, or maybe an inhaler for asthma. Have you ever wondered where that came from? Well, someone had to have the idea that that was something that should be treated with a drug. They had to find the target by understanding the science of the body and the disease. They had to then find a chemical molecule or other type of molecule that would hit that target, and that's called drug discovery. Then, the next thing you have to do is put that drug into a person for the very first time. Can you imagine how exciting but also how scary that is? Hoping that the drug will be okay, that they won't have any side effects, so you'll be able to go on and develop it as a medicine. Once you get past that hurdle, the next step is a series of experiments called clinical trials, and all the way through to something called a license. And then the drug is available for the use in the NHS or for healthcare to treat patients and the diseases. Then we have doctors maybe prescribing the drug or other healthcare professionals, pharmacists dispensing the drug, we have nurses maybe administering the drug. All of that, all the way through from finding that molecule, understanding the science, understanding how it works, all the way through to treating diseases is clinical pharmacology. It's never been more important than it is now. All of the work you'll have been hearing about with COVID, people trying to develop new medicines, new vaccines to manage COVID, that is all clinical pharmacology. So a great time to be dialing into this webinar. The clinical pharmacology degree at St George's, as you can see, is a 3-year program leading to a BSc honours. Honours means that it's a research project. There's a research project in the degree, and in fact, there are several projects in this degree. It's really important to say at this point that it's been designed, this degree, it's a new degree and it's been designed in collaboration with employers. The aim of our degree is to create graduates that are ready for work or further study in drug development or research or some aspect, for example, healthcare. And if we want our graduates to be work ready, we need to know what employers want. And they've had some input into the degree, as I'll show you later on. And our students all do work experience, a 6-week placement in year 2, in industry, for example, in a big pharma or in a contract research organization to see drug development at the coalface. They also all do research projects, and there's an option for a professional year, as Kate's explained, between years 2 and 3. Next slide, please. So what will you study if you study clinical pharmacology? This slide shows the big 6, our 6 modules, and you'll study these modules throughout the course. You do the introduction in year 1, you get a bit more detail in year 2, and you go to an advanced level in year 3. So a spiral curriculum, if you like. Working through them, on the left you can see the human cell exemplifying the science that you need to know to understand pharmacology. So you need to know how cells work, how the body works, some genetics, you need to know some physiology, you need to know some pathology, which is the disease. So you need to know all of that. But we don't just teach it in our course in a block at the beginning, we teach it as you need to know it. So you can then apply your knowledge to the pharmacology and to the drug development, etc., and so gain a broader understanding. The top 2 boxes are the pharmacology. So pharmacodynamics means how drugs work. And what you can see in the picture is the yellow blobs is a drug called a statin, which you've probably heard about in GCSEs in A-levels, which lower cholesterol. And here you can see that it's sitting, if you like, holding apart an enzyme, stopping that enzyme, which is called HMG-CoA reductase, from acting to synthesize cholesterol. And in this module, you learn all sorts of exciting things about drugs, past, present, and future, and how they work. For a drug to work, it's got to get to where you need it. So if you've got a headache, you need that medicine in your head. And the movement of drugs around the body is called pharmacokinetics. The little green man in the picture you can see is swallowing a capsule, and that drug will be absorbed into the bloodstream, distributed around the body, and then at the same time, the liver will be breaking the drug down and the kidneys will be excreting it. And this careful balance of these processes, pharmacokinetics, is required to get the drug to the right place in the right dose at the right time. The bottom two modules I've touched on briefly in my introduction are drug development and drugs in healthcare. This degree is really applied, and you'll see in a minute how hands-on it is. But you won't just be learning the theory, you'll actually be learning how pharmacology is applied, all the steps about drug development and how it's used in healthcare. And you'll meet patients, doctors, pharmacists, go on hospital visits, etc. So you can really get the big picture. The module on the right, Data and Statistics, is an important part of this course and might feel a bit scary for those of you who are not that keen on maths. But if you can imagine that drug development is a whole series of experiments collecting information, that's the data. And as you collect the data, you need to be able to look at it, manage it, handle it, interpret it, analyze it, and make decisions. And that's what data and statistics is about. And everyone who comes out of this degree will understand data, even if they're not a big statistics fan and they don't like maths. Next slide, please. One of the things our students love about the course is that it's very hands-on. And so about a third of the course is lectures, but a lot of the course is doing stuff. From the top to the bottom and from left to right, you can see that our students do practical skills every week, either clinical trials or laboratory skills. And the data that they generate from those practicals goes into the data management sessions that they have where they analyze their own data, their class data, etc., and learn how to do data handling and statistics. In the clinical trials, for example, our students in their first month of first year have already done a session called How to Tell if Someone's Alive, measuring pulse and blood pressure and respiratory rate and oxygen, that kind of thing. And they go on to do some little clinical trials. They do blood taking, drug administration. You'll be glad to know that's on a dummy to start with, and then things like basic life support. So a good foundation, for example, if you did want to think about going on to graduate entry healthcare. But the reason we learn that in our course is because some of our graduates will go and work in clinical trials units where they are part of the team, seeing patients that are taking new medicines. At the bottom, you can see that work-ready skills are also all about being able to communicate, give presentations, work in teams. At the bottom left is one of our first year students at the end of semester one, standing up in front of an audience of over 70 people, including our principal and some visitors from Big Pharma, giving a presentation in a Dragon's Den event. And all our students come in scared. They can maybe just talk about a drug for a minute in their first small group session, and through the course we get them to do a lot more and more each week, presentation skills, courses, so that already by the end of year one, all our students are competent presenters, and by the end of the course, they'll all be stars. Teamwork, you can see a gang of students here who are presenting a poster that they've made of data analysis, and our course is quite small, which is a great feature of it. At the moment, we have between 50 and 60 students in a year, and so it's a very close-knit cohort, which is really important. And you can see that all of this information is being collected in a skills portfolio. So at the end of the course, you have something to show employers about what you can actually do, not just about what you know. Next slide, please. I've said already that our course is really hands-on and we have lots of different ways of teaching and learning. About a third of the course is lectures, and you can see at the top left here our gorgeous new Curve Lecture Theatre, which we opened this year. It's a really nice place to have lectures. And we encourage our students to be nosy and curious and to ask questions, so they're not just sitting there as passive recipients, they're participating. At the top right, you can see small group teaching sessions, and we have 2 of those a week. At the beginning of the week, you have something called the Hub, where students practice all their skills, presentation, analysis, critical appraisal, and they also have the same tutor every week. And that tutor is their personal tutor who can then go on to support them through the course. At the end of the week, you're in a different tutorial group, so you get to work with everybody on the course in some way or another, and that's called drug-based learning. And here we look back at the previous week's learning and apply that in a real-world scenario, like an experiment or a patient or a clinical trial. The other pictures at the bottom left shows our students doing a workshop. Here they're doing a clinical trial or working in the lab. And I think at this point, I'd like to emphasize, again, the small cohort and a very supportive course team. So there's lots of support for you making that transition from school to university. You'll see the same people. We know everybody's names. We're interested in how they get on. So someone will be looking out for you. Every student does work experience. I think I mentioned that. And it's another opportunity for me to say how the employers are contributing. So we have employers from a whole range of different types of sector offering work experience for our students, mentorship. There's an option to take time out to do a professional paid year between years 2 and 3. And as the course goes on and the students know more, we have more and more visiting lecturers coming in, bringing their expertise. And industry is really excited about this course because it's perceived that there is a skills gap in clinical pharmacology in the UK. There are lots of jobs and there are lots of people who want this course to succeed. And so we have a lot of support. Next slide. You must be worried thinking about coming to university at this time when we still don't know what's going to happen with lockdown. Are you going to be on site? Again, with challenges, there come great opportunities. At St George's, we have a great learning management system. We use Canvas. Some of you may know that from school. And this COVID experience has meant that we've all got to get much better at learning and teaching online. So we've already converted quite a lot of our course into interactive online learning. We have active live face-to-face small group teaching. We have workshops online, lots of worksheets, interactive things to do, quizzes, etc. And our students have all, although being sad not to be on site for this year, felt that the learning materials still make the learning interesting and exciting. And going forward, we will still have our practical sessions on campus. You can see this slide just shows a little front page of our Canvas page with some enticing looking modules, hopefully. Next slide, please. In my tutor group, I asked my students at the beginning of the year what they might like to do, and a lot of them thought maybe graduate entry medicine. And when I asked them again, about 2/3 of the way through first year, I asked them again and I said, "Are you lot all want to do graduate entry medicine?" And they said, well, it was maybe at the beginning, and now it's even more maybe, because they had so enjoyed the course at that point and so continue to do so, and also seen how many opportunities this opened up. There were many possible careers, not just medicine. So with this degree, you could go on straight into a job. You'll be ready to go and work in clinical trials or maybe in a lab. You could work with data. You could depend on what sort of person you are and what you like. You could also go on to do a master's or a PhD. You could end up in industry or in a university, that's academia. There are entry-level jobs at healthcare, for example, technical or managerial, that you could do with this degree, or you could go on to graduate entry healthcare, and you could work for regulators such as the National Institute of Health and Care Excellence, you may have heard of, doing critical appraisal, looking at the literature, working out what we should do to treat people the most effective way. There's a whole myriad of careers opportunities, and as I mentioned at the beginning, industry is very excited about this degree because they see this as a skills gap that needs to be filled, so there are jobs. Who knows, you could be the next person researching new drugs for COVID or for the next pandemic. I think that's my slides finished, Jenny. Oh, sorry, last slide. Just if you want to find out more, visit our website. Chat to our students. Here's Pfizer on UniBuddy. Have a look at some of our social media sites, particularly Clinical Pharm on Instagram, which is a blog of one of our first year students about her experience studying clinical pharmacology on our BSc. And I've put my email address, ebaker@sgul.ac.uk, and I'd be delighted to hear from any of you at any time if you have any questions. Thanks very much.